So, Helen said I come from the OECD. For those that don't know what the OECD is, it's an organisation of 36 member countries around the world, including obviously the United Kingdom, United States, Australia, New Zealand, many European countries, as well as Chile and others. Our mission is to bring governments and countries around the world together to promote policies that will improve economic and social well-being. Technically, we were established in 1961. We emerged, but we had roots from post-World War II. And we've actually done extensive work on mental health. I only joined about a year ago, but we've done work previously on employment and mental health. We're doing quite a big project on children and young people at the moment. And the work that I co-lead at the moment is seeking to benchmark mental health performance across the OECD. And when we say mental health performance, we're not talking just about health systems. We actually got a bunch of experts in the room, and when I talk about experts, I'm meaning experts by experience, workforce representatives, those from civil society, to tell us what was important when we did measurements. And we found out it was absolutely about user experience. It was absolutely about join up, which we've talked a lot about already in yesterday and today, and so forth. So by next year, we hope to kind of look at every country in the OECD and how they perform in those various aspects. Right, let's actually get on with this. I'm going to just present a few powerful slides about the United Kingdom and the context in relation to other OECD countries, just to bring an international perspective to this conference. If you're struggling at the back, I'll give you the colour code. Red is the United Kingdom throughout this presentation, and green is the OECD average. So, I don't need to talk to you about how many people experience mental health in the OECD. You're familiar with statistics. I'm talking to a room full of experts, so I don't want to repeat what you already know. But you'll see that the UK is pretty much similar to the OECD in terms of reporting, maybe slightly higher. And the official statistic we have is 1 in 6. This data comes from the Institute of Health Metrics and Evaluation, and it's quite recent. But what I really wanted to drill down into, and what this conference has really been about, is actually where are the differences. This statistic, I think, is really, really powerful. So in the UK, men in the lowest income group are more than 3 times more likely to report chronic depression versus the high income group. And what I find really interesting here is you'll see the United Kingdom and the disparity between low income and high income versus the average versus other countries. And you've got women on the left and men on the right, just to help those at the back who all you're seeing right now is a bit of a blur. So just to kind of unpick those statistics a bit more, women in the highest quintile in the United Kingdom experience depression at 6.6%. So they would be here. And the lowest is 16.5%. So clearly a large degree more. Men, it's even more stark. The highest quintile is 3.9%. So I'm sure I'm going to point in the wrong direction. And the lowest is 8.6%. Now, this conference has already touched upon the things I'm going to reinforce from the data that we've looked at worldwide. And that is that mental health results from a complex interplay of many factors, genetic, social and economic factors, and can be provoked and worsened by behavioural and environmental factors such as alcohol and drug abuse, poverty and debt. 5 minutes already? Give me, come on. Trauma and physical ill health. We've also found this map pretty powerful. For those that are Guardian readers, you might have seen the equivalent of this map online in probably November last year, except the Guardian made it very pretty and into yellow. But basically, it's how much mental health costs across Europe in terms of GDP. And you'll see that the United Kingdom is purple. So 4.1% of GDP is spent on mental health, or the equivalent of, in the United Kingdom. It's far higher in the countries that you can see in dark blue, and far lower in the countries that you can see in a kind of slightly mauve shade. But just to break it down for the United Kingdom, more than 36 billion euros in health spending, so 1.4% of GDP, is spent on direct costs. Just to give you an idea, the United Kingdom comes third after Germany and Norway. But these costs alone are only less than 40% of the total economic costs of mental health. The United Kingdom also spends 22.7 billion on direct social benefits, so 0.87% of GDP, including sickness, disability and unemployment. And 47 billion is in indirect costs to the labour market. And that includes lower employment and lower productivity. I should note that this is a significant underestimation here. There's costs not factored in, including social spending, such as higher social assistance benefits and higher work injury benefits. But it gives you a flavour of how much it's costing society that governments are not looking at this effectively and more thoroughly and addressing the issue. And because I've been given the 5-minute warning, I'm going to press on, if that's all right. This slide shows the difference between employment rates, whether you experience depression or not. So you're 36% less likely to be employed if you have chronic depression in the United Kingdom. Paul Farmer's just left, but he's done some amazing work for the government last year on looking at this very issue, employment and mental health. What I think is stark here is, so you'll see the EU average again is in green and the United Kingdom is in red. The EU average is that there's a difference of 27 percentage points. In the UK, it's more than 36 percentage points. So there is a problem here and it needs to be addressed. We've talked already about employment, unemployment and mental health, but people who are employed generally report lower levels of depression than those who are not. And the flip side of that coin is people who experience mental illness are more likely to be unemployed and find it difficult to come back into employment. And I know we had a really fantastic presentation yesterday about this paradox as well. So I'm not saying this should be forced, but that we should be aware of, you know, when people fall out of employment, we need to be conscious of what that means and may lead to and help people. And in the United Kingdom, in the OECD, we talk about a vicious cycle where the longer people are out of work, the more damaging the consequences for their mental health. And on the United Kingdom, a couple of years ago, we did an assessment across the life course about policies and, you know, which countries were doing what. On a positive note, we looked at 6 areas of the life course and found that the United Kingdom at least has policies and implementation across all 6. However, we found across the EU that there were often not enough policies or interventions targeting older people or unemployed people. And when we talk about these policies about older people, they tend to be actually provided outside the health system. There's nothing wrong with that, but we need to be conscious that we are relying upon local authorities, social care authorities, and the voluntary sector, and what pressure that puts on those entities. I think on the third point here, programs that foster good mental health and interventions can identify and respond to mental distress should be priorities. We've talked about throughout this conference the relationship between the distance between social structures and mental illness and how it deteriorates. It's almost like a spectrum. And I'm now being told to stop. And just to say, it goes without saying that there is a clear economic case for further investment. What I have done, to the detriment of my back, so please take them all, is that much of this slide draws upon one report, which is Health at a Glance, which we published last year. Feel free to take it because it saves my back taking them back to Paris. And we also have a recent publication on children and young people's mental health in the digital age, so looking at social media, which is an issue that the United Kingdom is particularly aware of. So please take them because I don't want to take them back with me. Thank you very much.